Hey guys, it's Nurse Gwenny. Let's talk about cardiac tamponade. Cardiac tamponade is when the pericardial sac, or the sac that kind of envelopes the heart, and usually it's pretty snug around the edge of the heart, but in cardiac tamponade, that fills up with fluid. The number one cause of it is actually malignancy, but in emergency medicine, we tend to talk about it more with blunt trauma. If somebody who was an MVC slams their chest on the steering wheel and develops that cardiac tamponade, but you're actually gonna see it a lot more often in malignancy patients. Anywho's, if you see cardiac tamponade, you're going to notice Beck's triad. That's three things that are going to happen. You're going to hear muffled heart tones. So when you auscultate the patient's lung sounds, it's going to sound like you're listening underwater because the heart is surrounded by that fluid in the pericardial sac that's pressing in on the heart. Another thing that you're going to see is narrowed pulse pressure. So your systolic pressure is going to come down, your diastolic pressure is going to come up, and that's because we have Starling's law. We can't push that blood forward because the heart can't open and stretch during diastole because that pericardial fluid is pushing down on the outside of that heart. So you'll see that narrowed pulse pressure. The third thing that you're going to see is JVD, or jugular vein distension. And again, because the heart can't push and move that blood forward, it's backing up, and those large veins that come right out of the top of that superior vena cava are going to be your jugular veins right there that you're going to see big and enlarged on those patients. Now, another sign that you might see, it's not part of Beck's triad, you might see electrical alternans. So that's on your cardiac monitor or on your EKG. You're going to see a tall spike and a little spike, and a tall spike and a little spike. They are alternating, electrical alternans. And that's happening because I want you to think of these cardiac leads like microphones. If this was a microphone hooked up to my phone, if I had it really close to my mouth, it would be really loud. The amplitude that it's picking up is going to be taller. Whereas if I scooched this away from my mouth, it wouldn't be picking up as much sound and your amplitude will be smaller. That's exactly what's happening with the heart. My electrodes are affixed here on my chest, right? And my heart is sitting in a sac full of fluid. So every time the heart beats, it swings forward, it's closer to these microphones, and then on the next beat, it swings backward inside that pericardial sac that's full of fluid. So you get that electrical alternance where you get a tall amplitude, short one, tall one, short one. If you see that, you need to assess further and see if you've got any of those Beck's triad symptoms for cardiac tamponade. Now, what are we going to do about it? Well, usually a pericardiocentesis, which is an ultrasound guided huge needle that we put in right here under the sternum to drain the heart. When I say I don't mean me. Somebody else does it, like a physician. But some flight crews have protocols to do that, or we take the patient to the OR and perform a cardiac window to drain that excessive fluid. I hope that helps you guys. I'll see you on the next video.